Hey everyone, welcome back to Student Nurses Station. I'm Nurse Don from the University of California College of Nursing.
And I'm Nurse Jill, also from UCSF.
We are so glad to have you here with us today for another deep dive into the world of nursing.
Now, before we get started, just a quick reminder to hit that like button, share this with your fellow nursing students, and subscribe to our channel so you never miss out on these awesome discussions.
We love hearing from you guys, so let us know down in the comments what topics you'd like for us to cover in future episodes.
And hey, while you're down there, check out that link in the description. It's packed with free, downloadable nursing books to help you study.
We know you all are super busy with classes and clinicals and maybe even a part-time job or two, so we really try to make these deep dives fit into your crazy schedules.
Absolutely. Whether you're commuting to class, doing laundry, grabbing a coffee, you can pop in those earbuds and let us be your study buddies.
So today we're putting on our thinking caps and we're diving deep into the world of nursing theories.
These theories, they're not just some abstract ideas that you have to memorize for the NCLEX.
Right.
They're the foundation of everything we do as nurses. They give us that framework for how we approach patient care, how we make those critical decisions, and how we deliver truly holistic care.
Absolutely.
And to help you guys really grasp these theories, we're going to be tackling some practice questions from the TFN Situational Reviewer.
So think of this like a rapid-fire review session, but with a twist.
Exactly. We're not just going to tell you the right answer. We're going to break it down for you. Explain why it's the right choice and how it connects to the bigger picture of nursing.
We really want you to walk away from this episode understanding these concepts.
Yeah.
Not just, being able to just spit out answers.
All right, so let's dive into our first question. A nurse is caring for a post-operative patient with a high risk of infection due to the surgical wound. The nurse ensures that the patient's environment is clean and properly ventilated. Which nursing theorist's principles are being applied?
This one really makes me think about how important a clean environment is for healing. I'm kind of leaning towards Dorothy Orem, option C.
Okay.
Her self-care deficit theory seems to fit, right? Because cleanliness is part of patient self-care.
That's a good thought. Nurse Dawn Orem's theory definitely emphasizes patient self-care and independence, and a clean environment does contribute to that.
Right.
But the real heart of this question is that emphasis on the environment itself. The theorist who is all about a clean and well-ventilated environment to prevent infection and promote healing was Florence Nightingale.
Florence Nightingale, the OG of nursing.
Exactly. Nightingale's environmental theory isn't just about, wiping things down. It's about changing the patient's surroundings to help them recover. Think about things like light, temperature, noise levels. It all matters.
It all influences a patient's healing process.
Exactly. And you know what? These principles are woven into everything we do as nurses. It's not just history.
That's so true. When I think about it, it's all those basic things we learned, like keeping our workspace clean, washing our hands constantly, making sure the temperature and lighting are good. It all goes back to Nightingale, doesn't it?
Absolutely, it does. We really see how these theories aren't just some old textbook stuff. They are living, breathing concepts that we use every day.
Okay, so let's move on to question number 2. A patient with chronic obstructive pulmonary disease, or COPD, is struggling to maintain their activities of daily living. According to Orem's theory, which nursing action would best address the patient's needs?
Okay.
All right. I'm thinking about Orem and her focus on self-care. And I'm going to say, A, teaching the patient how to monitor their oxygen saturation. Seems like a good way to give them some control and promote their independence.
You got it, Nurse Dawn. Teaching the patient about oxygen monitoring is a perfect example of how we use Orem's self-care deficit theory. Remember, Orem's theory is all about figuring out what a patient can do themselves and where they need our help.
It's about finding that balance.
Exactly. We want to support them, but we also want to encourage them to be active in their own care.
Right.
So by teaching them about oxygen monitoring, we're not just giving them information, we're giving them a tool to manage their condition and feel more in control.
Okay, on to question number 3. A nurse, using Peploss theory, observes that a patient is reluctant to open up during their orientation phase. Which of the following actions would be most appropriate for the nurse to take?
Right.
Peploss theory really focuses on that nurse-patient relationship. So I'm going to go with B, build trust, by actively listening and providing empathetic responses.
Spot on, Nurse Dawn. Peploss theory really emphasizes the importance of that therapeutic relationship. And that initial hesitation that you mentioned, it's totally normal.
Yeah, for sure.
Remember, the patient is meeting someone new, often in a situation that is already stressful. It takes time to build trust, especially in those early stages.
You really have to lay the foundation.
Exactly. Active listening, demonstrating empathy, creating a safe space for them to share. It's all crucial when we're applying Peplaw's theory. Think back to your clinical experiences.
I remember this one time during my psych rotation, I had this patient who was extremely withdrawn. It took days of just being there for them and being empathetic before they started to open up. But once we built that trust, it was amazing. We were able to connect with them on a whole new level, and it made such a difference in their care.
That's a perfect example of how Peplaw's theory comes to life. Building that rapport allows us to truly understand our patients and provide the best possible care.
Okay, let's keep going with question number 4. A nurse in a community health setting is planning interventions for a culturally diverse population. Which theory would be most applicable in ensuring the care is culturally congruent?
Okay.
Well, this one is all about respecting different cultures and practices. So I'm going to go with B. Leininger's transcultural nursing theory.
You are absolutely correct. Nurse Dawn Leininger's theory is all about providing care that is culturally congruent. It recognizes that everyone comes from a unique background that influences their beliefs about health and illness and even how they heal.
It's about meeting people where they are.
Precisely. We need to think about things like language communication styles, religious practices, family dynamics, even food preferences when we are developing care plans.
Wow. It's really about making sure our care is sensitive to each individual.
Absolutely. It's about making sure it's not just effective, but that it truly meets their needs.
This is so important, especially as our world is becoming more and more diverse. I remember during my community health rotation, we were working with a lot of immigrants, and learning about their culture was key to building trust. We had to learn about things like traditional healing practices, family roles, and even how they view different illnesses. It was really eye-opening.
That's a great example of how Leininger's theory plays out in real life. It's about understanding that a one-size-fits-all approach just doesn't work in healthcare.
Okay, ready for question 5.
Bring it on.
A 35-year-old patient recovering from surgery expresses fear of returning to work. Based on Roy's adaptation model, how should the nurse approach the situation? Roy's adaptation model. That one's all about helping patients adapt to change.
Yes. Roy's theory is about how individuals constantly interact with their environment and adapt to different stressors.
It's a dynamic process.
Absolutely.
So I would say the nurse should assess the patient's coping mechanisms and role function. That's option C.
You got it. Roy's model really stresses how important it is to understand how a patient adapts in different areas of their life. This patient is scared because the surgery might affect their ability to work and fulfill their role. So the nurse needs to understand how they've coped with challenges in the past, what their current role looks like, and what kind of support systems they have.
So it's not just about the physical recovery, it's about the emotional and social aspects too. It's about the whole picture.
Exactly. Roy reminds us to look at the whole person, not just the medical chart.
This makes me think about us as nurses. We are constantly assessing and adapting, aren't we? Not just with our patients, but in our own professional roles.
That's a really great point. Every day is a new challenge, new situations that require us to adjust and find our balance. It's like we're living examples of Roy's theory in a way.
It's true. We're always adapting to new information, new technology, new policies, new personalities on our team. It never stops.
Absolutely. It's a constant process of growth and adjustment for us.
All right, question number 6. A nurse is teaching a group of diabetic patients about self-care practices. Which component of Pender's health promotion model is the nurse addressing by emphasizing the benefits of regular exercise and a balanced diet?
Okay.
Well, this one seems pretty straightforward. We're talking about Pender's model, which is all about promoting healthy behaviors. And the nurse is highlighting the good things that come from those behaviors. So I'm thinking it's B, perceived benefits of action.
You nailed it. Nurse Dawn Pender's model is all about understanding how people see those benefits. In this case, the nurse is explaining how exercise and a healthy diet can really help the patients manage their diabetes and improve their overall health.
But it's more than just, lecturing them about the benefits, right? You have to make it personal for them. Show them how those benefits relate to their own lives.
Absolutely. We want them to make informed decisions about their health, and that means helping them understand how their actions connect to what they want to achieve.
If they can see those benefits, they are more likely to actually make those lifestyle changes.
Exactly.
This reminds me of a patient I have in clinicals. He was having a tough time managing his diabetes. He just didn't see the point in changing his diet or exercising. But when we talked about his goals, like playing with his grandkids without getting tired, he started to get it. We connected those lifestyle changes to what he wanted to accomplish, and he became a lot more motivated.
That's a great example of how Pender's model works in real life. All right, ready for question 7.
Bring it on.
Which of the following scenarios best demonstrates the application of Neumann's systems model? Okay, so Neumann's model is about stress and how the patient responds to it.
Like those lines of defense.
All right.
So I'm going to go with B. A nurse identifies stressors affecting a family coping with a terminal illness.
You got it. Nurse Don Newman's model sees the patient, whether it's one person or a whole family, as a system that's constantly interacting with the environment. It's about figuring out what things are stressing that system out, both from the inside and the outside.
And it's not just about identifying those stressors, right?
Yeah.
We have to figure out what resources the family has, their coping mechanisms, and those lines of defense. Then we can come up with ways to strengthen those defenses and help them through that tough situation.
Exactly. Newman's model helps us look at stress in a really complete way, which is super important in nursing.
All right, what about question 8?
Okay. It says, a patient with a newly diagnosed chronic illness reports feelings of hopelessness. How can the nurse apply Travelby's human-to-human relationship model in this situation? Now, Travelby's model is all about empathy and truly connecting with the patient.
So I'm going to go with A. Providing reassurance and promoting hope through empathy.
You are absolutely right. Nurse Don Travelby's model focuses on the power of that connection between nurse and patient, especially when things are really tough. It's about being there for them with empathy and a genuine presence when they're dealing with emotional pain.
Right. It's about being that supportive person, that listening ear, and not judging their feelings. It's about letting them know they're not alone.
Exactly. When someone is feeling hopeless, especially after a big life change like a chronic illness, reassurance and hope can make all the difference. It's about helping them find meaning and purpose in what they're going through and being there to support them as they figure out this new chapter in their life.
You know, it makes me think about this one patient I had in clinicals. She'd just gotten a really difficult diagnosis and her whole world had been flipped upside down. I remember just sitting with her, listening to all her worries and fears and just offering words of encouragement. You know, it wasn't about fixing anything, but just being that source of comfort.
That's a beautiful example of how Travelby's model works in real life. It's about recognizing the human being in each patient and providing care that helps their mind, body, and spirit.
All right, on to question number 9. A nurse caring for a ventilated patient uses technology to monitor vital signs and ensure accurate medication delivery. How does this align with Loxton's technological competency as caring in nursing? Now, this one makes me think about all the tech we use, but also how important it is to balance that with human connection.
You're on the right track. Nurse Don Loxton's theory isn't about letting technology take over. It's about using it to enhance our understanding of the patient and provide even better care.
So I think I'm going with B. It integrates the use of technology to understand the patient as a whole.
Bingo! While technology is super important for monitoring and giving meds, it's crucial to remember that's only one part of the picture. Loxton's theory reminds us to use technology to gather information and see the whole patient, their physical needs, their emotional needs, and their spiritual needs.
It's about using tech to inform our care, not replace it.
Exactly. Right. We can't let that human element get lost in all the data and gadgets.
This really makes me think about continuing education as nurses. You know, technology changes so fast and we need to keep up to make sure we're using it ethically and effectively.
Absolutely. We need to be lifelong learners, always searching for new knowledge and figuring out how to apply it to improve patient care.
Okay, Nurse Jill, you ready for the final question for this part of our deep dive?
I'm ready. Hit me with it.
Select all that apply. A nurse is implementing Orm's theory of self-care, which nursing interventions demonstrate this theory. So we need to pick all the answers that show Orm's focus on helping patients become self-sufficient.
Right, exactly. Remember, Orm believed that patients should be as independent as possible in managing their own care.
So I'm thinking, A, assisting a patient with dressing after surgery definitely fits.
Okay.
It's about giving them support while still encouraging them to do what they can.
Excellent choice. What else?
I'm also going with B, teaching a patient how to perform wound care, giving them the knowledge and skills to care for themselves.
You got it. Teaching is so important in Orm's theory. And the last one?
Okay, I think it's D, encouraging the patient to take responsibility for managing their condition. It's all about helping them feel in charge of their health.
Yes. You got them all, Nurse Dawn. You've successfully applied Orm's theory.
Awesome.
All right, I think it's time for a quick break. We've covered a lot of ground in this first part, and I'm sure everyone could use a minute to process all this info.
You're right. We've explored some really key nursing theories and how they actually play out in nursing practice. We'll be back soon to dive into even more, so stay tuned.
And remember, guys, if you want to learn more about this stuff, make sure to check out those free e-nursing books in the description. They're an amazing resource to help you really understand these concepts.
We'll see you in a bit.
All right, welcome back, everyone.
Ready for more nursing theory?
Okay, let's jump right in with question number 11. All of the following are principles of Henderson's nursing need theory, except T. So we need to find the statement that doesn't really fit with Henderson's ideas.
Okay.
Now, if you remember, Henderson's theory is all about helping patients regain their independence by meeting their basic needs.
Right. It's all about getting them back on their feet and being self-sufficient.
Exactly. So thinking about that emphasis on those basic human needs, I think the answer has to be D, focusing on the use of medical equipment. Henderson's theory seems much more focused on that human touch, the nurse's role in providing direct care and support rather than relying on technology.
Yeah, I agree. While medical equipment is important, Henderson's theory is really about those fundamental things like breathing, eating, sleeping, communicating. You know, those essential things we all need.
Absolutely. It's about recognizing that while technology can be helpful, it can never replace that human element of care.
Okay, so what's question number 12?
All right. It says, a nurse is working with a family to create a health promotion plan using Pender's health promotion model. Which factors should the nurse consider? Now, this is where we really have to think holistically.
Absolutely. Pender's model is all about those things that influence a person's motivation to be healthy. It's like a puzzle with personal beliefs, social influences, and environmental factors all fitting together.
Exactly. So thinking about that, I would say, A, the family's cultural beliefs is definitely something to consider.
For sure. Cultural beliefs can have a huge impact on a family's health practices and how they view illness.
Right. And what about B, perceived barriers to change? You know, if a family feels like healthy choices are impossible, they're not going to be very motivated.
That's true. We need to understand what's standing in their way.
Exactly. Maybe they don't have access to healthy food, or maybe money is tight. We have to understand their specific challenges.
I'm also going to add C, immediate competing demands. Let's be real life. It gets crazy. Sometimes work finances or taking care of kids have to come first, and healthy habits might get pushed aside.
That's a really important point, Nurse Dawn. We have to remember that health is just one part of their life, and sometimes other things have to take priority.
And of course, D, biological risk factors like family history and genetics are important too.
Absolutely.
And we can't forget about E, the family's financial resources.
You've got them all, Nurse Dawn. You've nailed all the key things that Pender's model tells us to consider when working with families. It's all about that holistic view, understanding that health behaviors are influenced by so many different factors.
Okay, bring on number 13.
All right. A nurse manager is implementing the Casagra transformational leadership model in her unit. Which of the following actions align with this model? Okay, so now we're talking about leadership, but Casagra is a little different, isn't it?
Yeah, it's not like those typical leadership models.
Right. Casagra emphasizes something called servant leadership, where the leader puts the needs of their team first and creates a culture of support and growth.
Okay.
And it acknowledges the spiritual side of nursing, too. So I think the answer is B, promoting servant leadership through Care Complex workshops. Those workshops probably focus on teaching those key leadership skills, but with a focus on compassion and empathy.
That makes sense. Casagra is all about empowering others and making everyone feel valued, not about being bossy.
Exactly. It's recognizing that we're all in this together and we need to support each other to give the best care to our patients.
All right, question 14. According to Rogers' Science of Unitary Human Beings, which nursing intervention reflects the principle of integrality. Now, Rogers' theory can be a bit abstract.
Yeah, it can be a little out there.
So how about we break it down a bit?
Okay, remember, Rogers saw people as energy fields that are always interacting with their environment. And integrality emphasizes that connection between the person and the universe.
All right, so thinking about that connection, I'm going to go with B. Using therapeutic touch to promote energy flow. Seems to fit with that idea of being whole and balanced.
You got it. Therapeutic touch is a great example of how we can use the idea of integrality in nursing. It's about recognizing that we're all connected not just to each other, but to something bigger.
Right. And it's not just about touch either. It's about creating a healing environment, a sense of peace and connection for the patient.
Exactly. Rogers reminds us to consider all aspects of the patient, not just their physical body, but their emotional and spiritual needs too.
Okay, on to question 15.
All of the following are core concepts in King's goal attainment theory, except PT. Okay, this one is a little tricky. We have to find the concept that doesn't belong in King's theory.
All right, well, see, King's theory is all about setting goals with the patient and working together to reach them.
Exactly, it's very patient-centered.
So looking at the options, I think the one that doesn't fit with King's focus on teamwork and action is B, self-concept. While self-concept is definitely important in healthcare, it's not the main idea in King's theory.
You are right on Nurse Don. King's theory is more about that interaction between the nurse and the patient, that process of figuring out goals together and making a plan.
It's about giving the patient the power to be involved in their care and work towards goals that are meaningful to them.
Exactly, it's all about collaboration and taking action.
Okay, what's the next challenge?
All right, here's question 16. A nurse is using Betty Newman's model in creating a patient care plan. What level of prevention is addressed when the nurse provides vaccinations to a patient? Now, think about those lines of defense in Norman's model.
Okay, so we've got primary prevention, which is stopping the stressor from ever reaching the patient. Then there's secondary prevention, which is about stepping in early to minimize the impact. And lastly, there's tertiary prevention, which is about helping the patient recover.
Right, those levels of prevention are key to understanding Norman's model. So where does this scenario fit in?
Well, with vaccinations, we're talking about preventing the illness before it even happens. So that sounds like a primary prevention to me.
You are absolutely right. Vaccinations are a classic example of primary prevention. They're all about strengthening the patient's defenses and stopping those stressors from getting through.
It's like giving their immune system a boost, helping it fight off those bugs before they can even cause any trouble.
Exactly. You're doing great, Nurse Dawn. Ready for question 17?
Absolutely. Let's keep going.
Okay, here it is. A nurse applies Johnson's behavioral system model when caring for a patient exhibiting aggressive behavior. Which subsystem is the focus of this intervention? Johnson's model is a little different, remember. It looks at the patient as a set of interconnected subsystems.
Yeah, like a bunch of gears all working together.
Exactly. Each subsystem has a job to do, and they all contribute to the overall balance of the person. So if we're talking about a patient being aggressive, I'm going to say the focus is on B, the aggressive subsystem.
Okay, that makes sense. Johnson's model says that aggression is a normal human behavior and that this subsystem is about how people protect themselves, set boundaries, and react to threats.
Exactly. It's about understanding how they see the world and what makes them feel safe.
But it's not about saying aggressive behavior is okay, right? It's about figuring out what's causing it and helping the patient manage it in a healthy way.
Absolutely. Behavior is a way of communicating, and there's always a reason behind it. As nurses, we need to dig a little deeper, trying to figure out what's triggering the aggression. Is it fear, frustration, pain? Once we know the root cause, we can find ways to help.
Like peeling back the layers of an onion.
Exactly. All right, Nurse Dawn, ready for question 18?
You bet. I'm feeling like a nursing theory pro now.
Okay, this one says, a student nurse reviews Henderson's fundamental needs of nursing. Which of the following interventions are aligned with her theory? Now, this one asks us to choose all the actions that reflect Henderson's idea of meeting those 14 basic human needs.
All right, so I'm thinking about things like breathing, eating, sleeping, going to the bathroom, staying warm. So definitely A, assisting the patient with eating.
Good one.
What else? Henderson also talked a lot about hygiene, so I'm adding C,
Yeah.
helping a patient maintain proper hygiene.
Excellent. And don't forget about oxygen. So D, monitoring oxygen levels continuously is important too.
And we can't leave out E, encouraging family participation in care. That fits with Henderson's holistic view.
You got them all, Nurse Dawn. Henderson really emphasized those basic needs and the role of the nurse in helping the patient meet them.
Okay, 2 more to go in this set. Let's do it.
Okay, here's number 19. In Peplaw's phases of interpersonal relationships, the resolution phase focuses on. Think about those phases: Nurse Dawn, orientation, working resolution.
So the resolution phase is the last stage, right? Where the nurse-patient relationship comes to an end, by closing a chapter.
Exactly. So what do you think is the focus during this phase?
I would say it's C, terminating the professional relationship.
You are absolutely right. The resolution phase is all about acknowledging that the journey is over. The goals have been met, the work is done, and it's time for the nurse and patient to go their separate ways. It's about recognizing how far they've come, celebrating their achievements, and preparing for what's next.
It can be bittersweet, though, can't it? Put so much into building that relationship.
It can be, but it's also a sign that we've done our job, that we've helped the patient to the point where they can move forward on their own.
That's a good way to look at it.
Okay, Nurse Dawn, ready for the last question in this set?
Bring it on, I'm ready.
All right, here it is. A nurse caring for an elderly patient uses Leininger's transcultural theory. What should the nurse prioritize to provide culturally congruent care? Leininger's theory is all about respecting different cultures, right?
Right.
So we have to choose the answer that shows that focus on providing care that respects the patient's background. I think the answer has to be D, all of the above.
Yeah, I agree. We need to think about the patient's diet, their spiritual beliefs, how they communicate. We can't just assume that everyone is the same.
Exactly. Leininger's theory reminds us that culture influences how we view health and illness, and even how we heal. It's about recognizing that there are many different ways of seeing the world.
It's about opening our minds and appreciating all that diversity.
Absolutely. And when we take the time to understand our patients' cultural perspectives, we can build better relationships, provide more effective care, and create a more welcoming healthcare environment for everyone.
Wow, we covered a lot of ground in this segment.
We did. You did a great job, Nurse Dawn. You really showed how well you can apply these concepts to real-life situations.
Thanks, Nurse Jill. This has been a great learning experience. I have a much better understanding of how important nursing theory is and how it can help us be better nurses.
Me too, Nurse Dawn. These theories give us a framework for understanding our patients, making good decisions, and providing really compassionate care.
And you know what? This deep dive has really sparked my interest in nursing theory. I'm definitely going to check out those free nursing books in the description and learn even more.
That's awesome, Nurse Dawn. Remember, the more we learn, the better we become as nurses. Okay, are you ready to tackle this last set of questions in our nursing theory marathon?
Absolutely, let's do this.
All right, question 21. A nurse is reviewing Roy's adaptation model with a new graduate. Which of the following behaviors would best represent the physiological adaptive mode? Now, Roy's model, it's all about how people adapt to changes in their health and environment, right?
Right. Roy identified 4 adaptive modes: physiological, self-concept, role function, and interdependence.
Yeah, each one represents a different way a person adapts to stressors.
Okay, so thinking about the physiological mode, which is all about those basic physical needs and how the body reacts to stress. I think B, adjusting to new medication side effects. That seems like a clear example of the body adapting.
You nailed it, Nurse Dawn. Adjusting to medication side effects is a perfect example of the physiological mode in action. The body is always trying to stay balanced, and when we introduce a new medication, it has to adjust.
Like it's recalibrating.
Exactly, and this is why it's so important to keep a close eye on our patients, watch for those side effects, and educate them so they can get through that adjustment period.
Okay, what's next?
Question 22. A nurse using the theory of deliberative nursing process observes a patient repeatedly pressing the call light for minor requests. Which action aligns with Orlando's theory? Orlando's theory focuses on the nurse's immediate reaction to a patient's behavior.
Right. Orlando emphasized trying to understand the meaning behind a patient's behavior.
Right.
It's about looking deeper and figuring out what's really going on.
Exactly. So in this case, instead of getting frustrated, the nurse should ask the patient about any underlying concerns that might be causing this behavior. That's option B.
Right. It's about validating the patient's feelings and trying to see things from their point of view.
Exactly. Maybe the patient is anxious or insecure, or maybe they're just lonely and need some interaction. Whatever the reason, we need to address that underlying need, not just the behavior we see on the surface.
It's like that behavior is their way of communicating their needs to us.
Exactly. And by being empathetic and understanding, we can create a much better environment for our patients.
Okay, on to question 23. A patient recovering from trauma struggles with maintaining hope. How can the nurse integrate Travelby's model into care? We talked about this before, but Travelby's model is a powerful one.
Absolutely. Travelby's human-to-human relationship model really focuses on how important human connection is, especially when someone is suffering. It's about being truly present, showing empathy, and supporting them through their pain.
So in this situation where the patient is struggling to find hope, the nurse needs to offer emotional support and counseling. That's C.
That's a great start, Nurse Dawn. But Travelby's model goes beyond just emotional support. It's also about helping the patient find meaning and purpose, even in the face of trauma.
So B, discuss the patient's goals and aspirations. Would that fit with Travelby's model?
Yes. Even though they're going through something difficult, talking about their hopes and dreams can help them focus on the future and see that there's still a path ahead.
It's like helping them see that this experience doesn't have to define them.
Exactly. Travelby reminds us that healing takes time, and our role as nurses is to be there with them on that journey, offering support, empathy, and hope every step of the way.
Okay, what's next?
Question 24. In Norman's systems model, a patient under stress is displaying elevated heart rate and blood pressure. The nurse intervenes by teaching relaxation techniques. What type of prevention is this? Remember those levels of prevention we talked about? How do they apply to Newman's model?
Okay, so primary prevention is about stopping the stressor before it affects the patient. Secondary is about early intervention to minimize the impact. And tertiary is about helping them recover after they've been affected.
Exactly. So where does this scenario fit in?
Well, the patient already has those physical symptoms of stress, the high heart rate and blood pressure. So the nurse is stepping in after the stressor has already had an effect. That sounds like B, secondary prevention.
You are absolutely right. By teaching relaxation techniques, the nurse is trying to reduce the harm that stress is having on the patient's body and help them feel calmer and more in control.
It's about giving them the tools to manage that stress and prevent things from getting worse.
Exactly. Norman's model shows us how important it is to see those early signs of stress and act quickly to support the patient's well-being.
Okay, question 25. A nursing educator is discussing the Casagra transformational leadership model. Which key component is emphasized in promoting servant leader spirituality? Casagra is all about compassionate leadership and recognizing that spirituality is part of nursing.
Right, it's a very holistic approach to leadership.
So I'm thinking the answer is C, implementing reflective care practices. It seems like reflecting on our experiences is a big part of connecting with our own spirituality and understanding our patients better.
You are absolutely right. Nurse Dawn Casagra recognizes that reflection is so important for developing compassion, empathy, and a deeper connection to our work.
It's like finding that inner peace so we can be fully present for our patients.
Exactly. And by making reflection a part of our leadership, we can create a more mindful and compassionate culture on our teams.
What's the next challenge?
Okay, question 26. A nurse is applying the principles of Nola Pender's health promotion model to encourage lifestyle changes. Which of the following factors should the nurse assess first? Now, Pender's model is all about understanding the things that make someone more or less likely to make healthy choices.
Yeah, it's a really comprehensive model that looks at a lot of different things.
It does. But if we're talking about the first step, I think the nurse needs to understand what the patient thinks. So I'm going to go with A, the patient's perceived barriers to exercise.
That makes sense. We need to know what's stopping them before we can help them make changes.
Exactly. Before we can encourage healthy changes, we need to know what obstacles the patient sees. Are there physical limitations? Do they have access to resources? Do they even believe they can change? Whatever those barriers are, we need to acknowledge them and work with the patient to find solutions.
It's about being on their side and understanding their situation.
Absolutely. We have to recognize that changing behaviors takes time, and we need to be patient and supportive as we help our patients get healthier.
Okay, just 2 more questions to go.
You got this.
Yeah.
Nurse Dawn question 27. A nurse educator uses Henderson's need theory in a lecture. Which nursing intervention best reflects helping a patient maintain body mechanics? Henderson's theory focuses on those 14 basic needs.
Right, those needs that are essential for people to be healthy. And one of those needs is being able to move and position themselves safely and comfortably. So I think the answer is A, teaching proper lifting techniques. That's a really important skill for nurses and patients to have.
Absolutely. Teaching proper lifting techniques is key to helping patients maintain good body mechanics and prevent injuries. And it fits perfectly with Henderson's idea of supporting the patient's ability to move freely and safely.
It's about preventing those back injuries, which can be really tough for everyone.
Exactly. It's about making sure everyone stays safe and healthy.
Okay, bring on the final challenge.
All right, here it is. In PEPLAW's orientation phase, the nurse identifies the patient's primary concern. What is the primary goal of this phase? Remember those phases: orientation, working, and resolution.
Right, the orientation phase is that first meeting where the nurse and patient are getting to know each other, making that initial connection.
Exactly. It's like building the foundation for a relationship.
So I would say the main goal of this phase is building trust and rapport.
You are absolutely right, Nurse Dawn. The orientation phase is all about creating a safe and welcoming space where the patient feels comfortable opening up and working together with the nurse. It's about building that connection, that trust that allows the relationship to grow.
And without that trust, it's really hard to move forward.
Absolutely. Trust is essential for any effective nurse-patient relationship. Well, Nurse Dawn, we did it. We tackled all 28 nursing theory questions.
I feel like I learned so much going through these questions. I have a much better understanding of how important these theories are and how they can help us be the best nurses we can be.
Me too, Nurse Dawn. These theories give us a framework for understanding our patients, for making those tough decisions, and for providing truly compassionate care.
I'm definitely going to keep exploring these theories. Don't forget to check out those free nursing books in the description, everyone.
Absolutely. Knowledge is power, and the more we learn, the better we can care for our patients. And that wraps up our nursing theory deep dive for today. We hope you found it helpful and maybe even a little inspiring. Remember, these theories aren't just ideas. They can really guide our practice and help us provide the best possible care to our patients.
Make sure you hit that like button, share this episode with your classmates, and subscribe to Student Nurses Station so you don't miss any of our future deep dives into the world of nursing. Until then, happy studying, everyone.
And keep those nursing theories burning bright.